We try to be responsive to any requests we get.
Your agencies haven't been responsive at all. They're giving me the middle finger. They've been giving me the middle finger for years. I think you may be aware I've written over 60 oversight letters having to do with our response to COVID, the vaccine injuries to your agency, and to your sub-agencies. I want to talk about three of those primary requests. The first is on the origin of COVID. And Anthony Fauci's emails. In June of 2021, 4,000 pages of his emails were released under a FOIA request. Within a week of that, I had 5 members of the Homeland Security Governmental Affairs Committee sign a letter requesting those 4,000 pages unredacted. But let me first ask the question. You do agree the fact that FOIA, those requests can be redacted for a host of reasons, but congressional oversight, we're not subject to those redactions, correct?
Senator, I don't want to speak out of turn, but we continue to make sure that we protect confidential information, the privacy of information, and we try to do the best we can to respond
but again,
to
we're not subject to those same redactions. And U.S. Code 5 U.S.C. Section 2954 states that an executive agency, on request of the Committee on Governmental Affairs, any 5 members thereof shall submit information requested of it. So as an accommodation, we went from 4,000 pages requested 400 pages unredacted. Over the course of a number of months, we were allowed in a reading room. We got 350 pages. We were able to look at them, couldn't take copies, could take notes. We're down to the last 50 pages of the Fauci emails. I was hoping that you would bring these unredacted, because last year in this similar hearing, I asked you about these, and you said, quote, that you are absolutely entitled to the information that by law a member of the Senate or House should get. Again, the law is 5 U.S.C. 2954. It states you shall turn those over to us. Why haven't you turned those over to us here a year later?
And Senator, I'll try to make this as clear as I can, because secretaries before me and others who have testified before me have tried to answer this question that many senators and House members have asked over the past. It is an accommodation process where we try to make sure that we fulfill the request as best we can without undermining national security, confidentiality, and the interests of
So, Mr. Secretary, you realize if you're withholding information from Congress required under law, that at a minimum, you should be providing me a privilege log justifying the reason you're withholding this information. This has been a year since you said that I was entitled to the information that required by law. We have not gotten response from you. We have not gotten a privilege log. Why not? Why aren't you listing the privilege you're claiming to withhold these 50 pages unredacted? What privilege is it that you're claiming to withhold this information, not only from Congress, from the American public? What's the privilege being claimed?
And Senator, I know that your staff has been engaged with our team when it comes to trying to respond to some of the requests. We will continue to try to respond the best we can.
Well, you haven't responded. You should have provided us a privilege list, a log, so we would understand what privileges are you asserting withholding this information from the American public. So I'm expecting that privilege log post haste. Okay, now let me move on to 2 other things. There's a standard operating procedure issued in January of 2021, shortly after the vaccine got its emergency use authorization, laying out the analysis that FDA and CDC were going to do on the vaccine adverse event reporting system. First, proportional reporting ratio. We've gotten the runaround on that. Finally, they said it's going to be empirical Bayesian analysis. I have written, I think, 5 or 6 oversight letters trying to obtain that analysis on the VAERS system. I've gotten bupkis. I haven't gotten anything on this whatsoever. Why is the FDA and CDC, why are they withholding their analysis of their vaccine adverse event reporting system? We fund the agencies, we pay their salaries, that data should be made available to the American public. Why isn't it? Why are your agencies withholding that information?
Senator, I'll try to make sure I can get back to you. I can't speak directly for the actions of FDA, but what I will tell you is that we try to be responsive to any requests we get.
You
from
have,
members of the Senate.
your agencies haven't been responsive at all. They're giving me the middle finger. They've been giving me the middle finger for years. So, Mr. Secretary, I would request a phone call within a week or two. You check into this. I've also gotten, I've run out of time, some significant questions about hot lots that the agencies are completely ignoring. I mean, things like over 5,000 adverse events with one lot of COVID vaccine versus the most adverse events associated with one flu lot, 137. These are serious issues, and the American public deserve this information. So I'd expect a phone call personally from you with a privilege log and responding, why are you not releasing the analysis on VAERS? Why can I not get a legitimate response in terms of hot lots that have been identified repeatedly by a number of outside researchers?